Here at Rose Physical Therapy, we see a wide variety of musculoskeletal conditions. Today we're going to talk about post-operative knee patients. So with post-op knee patients, that can include anything from ACL reconstruction to a total knee replacement or knee meniscectomy or something of the variety. So the first thing that we're going to do is talk about the warning signs of a DVT, or a deep vein thrombosis. So you want to make sure that you look out for this because it's a severe medical emergency. If you have any of the following conditions, then make sure to contact your physical therapist or your doctor immediately. And up next we have what's called the RICE protocol. That's an acronym that stands for rest, ice, compression, and elevation. So all of these things are good to do post-operatively, at least in the short term, because they can help control the swelling and the pain. So rest simply means you don't want to be on your feet all day. You don't want to be stuck in bed the whole time either. You want to find that balance so you're not causing more pain or more problems. So the I stands for ice. So you can ice, we recommend 20 minutes on, 40 minutes off on the hour. That helps prevent swelling, and it also helps control pain. So if you're in pain, pain medication is one thing, but ice is something you can do to help relieve that as well. Next you have compression. So the ACE bandage that you probably are provided with, you want to make sure you keep that applied and make sure it's tight enough that it's kind of compressing the area, which will prevent fluid from getting in and sitting there and staying there. It helps get it back up to the heart so your body can excrete it. And last but not least is elevation. So elevation is just like it sounds. You'll want to keep your leg up at a position that's higher than your heart, and that will help the edema and the swelling drain from your knee back up towards your heart and once again out of the body. So the most important thing that you can do at home after the surgery is try and get the muscles to start firing again. So coming up, we have 3 different exercises demonstrated for you on ways to strengthen the muscle and help get the movement back that you have undoubtedly lost after the surgery. So the first exercise that we're going to work on today is called a quad set. So with a quad set, we're working on straightening the knee, which is extremely important because every time you take a step, if your knee isn't straight, then you're not going to be walking even on both sides, and it can actually lead to muscle imbalances and more problems down the road. So for this exercise, all you have to do is take something like a towel roll for comfort and place that underneath the back of the knee. And Clay, you can go ahead, and I want you to push the back of your knee down into the towel and hold it for 10 seconds. So as you're doing this, you should start to feel the muscle on the top of the thigh working, and it's important to make sure that this is not painful as you do it. Alright, so for the next exercise, we have heel slides. So kind of the opposite of the quad sets, which are working on straightening the knee, heel slides are going to be working on bending the knee, which is also very important. So I recommend finding a surface at home where you'll be able to slide your heel along without it getting scraped or anything like that. Here at the clinic, we tend to take a towel and place it underneath the heel. It just makes everything slide better. You want to make sure you're not scraping your leg on the carpet or anything like that and causing a wound. So Clay, you can go ahead. I want you to slide your heel up all the way to your butt, as far as you can tolerate bending it, and then back out. So I want you to keep about this pace at home. As we move along further and further, as the surgical site starts to heal, then we can start adding more pressure and working on bending it. But as of right now, within the first couple weeks post-surgery, we don't want to push it too far. Once again, just keep it underneath the pain threshold. So for this last exercise, it's called a straight leg raise. So as simple as it sounds, here we go, we'll demonstrate it for you. So the first thing you'll want to do is do a quad set. So make sure that you're pushing the back of that knee down into the table and keeping that knee nice and straight. Then from there, keep your toes pointed up and go ahead, Clay, and lift your leg up until it's about parallel with the opposite thigh. Hold it for a second, then bring it back down. Now, it's important not to rush through this, and once again, don't work through the pain.